so much, Henry. Probably the hardest working woman in Cayuga County right now is our guest speaker. She is the Director of Health for Cayuga County. Please join me in welcoming Kathleen Cuddy as our guest speaker via Zoom today.
Oh, that's great to actually see that. Thank you. That's really cool to see all the hands clapping, but thank you. And I won't say I'm the hardest working, but I'll put myself in the top 10 right now. I will. Thank you for your interest in hearing, and it's always good to have an opportunity to talk with community members about what's happening. I did not formulate any particular outline or presentation really deliberately, because I think a lot of times with general questions, it kind of directs the flow of conversation, and this forum often allows for that kind of give and take. But I'll just give a little synopsis of some of the, positives and negatives we've been dealing with lately. Much of it you may already be familiar with from what you're reading in the newspapers, not just locally, but nationally. And then I'm happy to take some questions on that you might have, to the ability I'm able to help. Yes, Ed.
All right. This is from one of our members who couldn't be part of it today. She's asking two questions today. For the vaccine distribution, residents are required to register via a website. There are residents in the city as well in rural areas where internet access is a concern. We also have older residents who are not computer literate. With those demographics in mind, is there any consideration being made to include the phone option for vaccine registration process?
Yes. So there's the
That's
short.
easy.
Yes, but precisely how we're doing that, we're working out our final presentation. So I'll just back it up a little bit just to talk about vaccine in general. So as you're all aware, vaccine distribution really is contingent on two factors. In our case, primarily, it is personnel to do the vaccination and actual allotment of vaccine. Fortunately, I can't say enough great things about the community partnerships we have to create personnel and bench depth in delivering the vaccinations. I don't know if any of you had the opportunity to go to one of our, I'll call them a standing clinic versus a mobile one, that we've had at BOCES or Port Byron. If you did, you had the opportunity to see the setup and our partnerships in action. The health department typically will take leads when it comes to vaccine distribution. The city of Auburn is helping up considerably. We have additional county employees who are helping us. We have some volunteers who are helping us. The hospital is helping us. It's truly inspiring when you see the commitment of everyone for this purpose. It's really important to us to make sure that one, people need to be scheduled, which goes back to that question that I'll address in more depth in a minute about how to register. And the scheduling is important because we have to make sure that we have enough vaccine for the people who are there, but you can't leave vaccine in a vial, right? So you have to have some people waiting in the background also. So we may think that we have 200 doses. We might get lucky and have 5 of those vials have an 11th dose. So we need to make sure we have at least 5 to 10 standby people to receive vaccine. When you come into our standing clinics, we don't want people to be within close proximity of each other. So we keep our physical distancing and mask wearing, of course. But we also don't want you to have interaction for more than 5 minutes at any particular station. So you come in, there's a greeter, you go to registration, if there's issues with registration, because there's this attestation form that the state is mandating that is done electronically, but certainly a good number of people don't necessarily have a smartphone or device on them. So it's done on paper if that's the case. Then you go into your medical screening where staff review any, if you said yes to any of the, I won't call them disqualifiers, they're screening questions that make you more aware of whether you should receive the vaccine that day or you shouldn't. Any questions that beyond what the screening can respond to, go to a medical consultant. And we've had wonderful attention from medical doctors, pharmacists, nurse practitioners, some that we are offering a stipend to, some that we are volunteering to perform this medical consultation. Our medical director is Dr. Joya, and he, together with our community health services director, really also kind of, for some people, known as a director of nursing type role, Nancy Purdy. They work so closely together to make sure they have the latest and greatest information available to anyone. But all of our doctors who are coming in are very well versed on the vaccine and what may disqualify someone from getting it. Then you move from your screening or consultation over to the vaccination station. That will be our nurses working with a clerical support person. Now, as we know, our clerical support people, we call them our vaccinator assistants. They're people from all of their, right? They're not necessarily people who are paid clerical people on staff. They're people who simply aren't clinicians who are supporting the mission. So our nurse or one of the city EMTs who learned how through the fire department, or we've got some county EMTs who are starting to meet the qualifications to be vaccinators. You get your shot. You move on from there to a waiting area. You wait your 15 or 30 minutes based upon your risk status, which that's where that screening comes into play. So for example, if you've ever had some sort of a strong allergic reaction to something, you may be asked to wait 30 minutes rather than the typical 15, and then you walk out the door. The challenge I think a lot of people have had is how are we getting our second dose? When we started this process with vaccine, as you're reading, so this goes to some of the challenges, right? The state's putting a lot of parameters on how we can deliver the vaccine and to whom we can deliver it. We are using the state clinic data management system for registration, which is good, but we don't have an electronic medical record within the health department. We didn't need one once we no longer had the certified home health agency. We didn't have that type of patient caseload. So now we have to take everyone who is in the CDMS state system, download their information, which includes phone numbers and emails. They're downloaded into a spreadsheet, and we're actually sending out emails to people with the link to their second dose registration. Again, that goes back to the email situation. So we know right now anyone who registered initially and received a first dose more than likely had email or had someone who was their designated email person. And we can see if they don't, and we've got phone numbers. So we're actually in the process right now of divvying up a phone list to call people. That's not the most efficient. We want people to have emails if we can. So that's our stationary clinic process. We're doing this at BOCES. We had one at Port Byron Schools, which was great, set up the same way. We are looking at a couple other sites to use. If we had our druthers, we'd be at BOCES all the time because it's just so great and it's one level. That's the biggest thing, is the accessibility aspect. There is a lot of walking even with that accessibility. So as we know, particularly if you've got any physical infirmity, it takes, it might only be 30 minutes from beginning to end, but it still might be a long walk from the parking lot, et cetera. That was one of the detriments. We know that our community college was more than willing to help us out, but it's hard to find enough space on a flat level there. One of the other sites we're looking at is the Finger Lakes Mall and some other schools, but Port Byron really was very accommodating to us also. So that's
Kathleen?
we're looking to
Go
go
ahead.
mobile also. And that's in the works. And that's where I hope that we will have better success with some of our more rural population, as well as people who we know the further you get from the city, sometimes the harder internet access is, not just if you don't have the affordability or the knowledge base for using internet, which can be anywhere. But we'll be working with towns and villages to collect some of that information and set up some clinics remotely.
I have a question. Are you hearing anything from the suppliers, presumably the feds, on the upstream supply? Is it supposed to increase anytime soon? Anything definitive on that?
So nothing definitive, and I'll tell you, as a locality, we're probably at the tail end of that information chain. We do know that the state is working with the federal government to increase our supply. I honestly, I realize to general public, they may not consider this fortunate, but I look at us in Cayuga County as being fortunate and that we have had a steady supply. Granted, not a lot of supply, but every week we've gotten something. So we had an initial 2,000 doses that was sent to us that we pushed out within a 7-day time frame. And then we were getting about 200 doses a week. This is our 3rd week. One of the things that changed for this week was that we received 300 doses, 200 doses for the priority groups that we are charged with reaching out to, and then 100 doses to work with OPWDD, so the Office of Persons with Developmental Disability. And so we'll be working on how we're going to best deliver vaccine to residents of OPWDD housing.
Henry McDonald. Correct me if I'm wrong, but my understanding is that at this particular point in time, basically the county health departments are being kind of urged to only work with the 1A and 1B one leftover 1As into the 1Bs, and the seniors 65 and older being told to go to pharmacies. Is that correct?
You are correct. So the 1A people are the healthcare workers, and they are really encouraged to go through hospitals. But initially, this is how our information changes on a daily basis, particularly when vaccine was first rolling out. So we knew we got some, it was the 1As. Great, okay. But the hospital, our hospital locally, got vaccine before the local health department, which was fine because the priority was to get the healthcare workers, and that's really important. They started on that. Then eventually the health department received some doses, and the 1B expansion, as you all well know, went from first responders very quickly to 75 up to 65 up. And that created a demand which could not be met, right? Because pharmacies did not have any vaccine at that point in time, although we were hearing they might. And this kind of went to the communication. It was a real challenge for all of us because we didn't know who was getting the vaccine and when. And for any of you who may have attempted to register online, you would see the link go live, and literally within 7 minutes, all of our slots filled up. 7 minutes, which blew my mind. And that was like 500, 600 slots that day. So that's when I think there was some readjustment of prioritization. The healthcare workers still are encouraged to go to the hospitals, and the hospitals are starting on their 2nd dose of healthcare workers. But if, there were times, just like with health department, with hospital, it was more important to get the vaccine into people's arms within one of the priority areas, even if it wasn't precisely the priority area designated to you. So we had a couple of clinics with the health department that, great, we served 65 and up. That was the eligibility. Then we were told, clamp it down and focus on the first responders, school personnel, public transit workers, grocery store workers, and some of the other 1B eligible. 1B was the tier that we were designated. And then for 65 and up, they were really being encouraged to go to the pharmacies and or the state testing sites, which at least we have one as close as Syracuse. We know that we're fortunate in that regard. But attaining a spot was hard. Right now, there are some federally qualifying healthcare centers who have gotten some doses, and they're being asked to focus on healthcare workers also. And then we don't know if there's going to be private providers. We know there are some private providers who have applied. This was an application process, but we're learning a lot more about how the vaccine's being rolled out as well.
Well, I know that Kinney's is doing. I'm scheduled for an appointment, but that is almost more convoluted than the county health site. The presumption is you have the ability to be able to print all of your information after you fill it out. You have to fill it out twice. Once is a part of a screening, and then you have to then redundantly do it for the state. Which makes no sense at all. And so, you have to have access to a computer and the internet. You have to have access to a printer to be able to print the information. And you have to have a smartphone because there's a QR code they want you to download. And I mean, and this is for 65 and older. And, we know that by and large, that's a population that's not very tech savvy. And so it really is putting a significant burden on the people who deserve and should be getting that vaccine and their ability to be able to acquire it. That's just my observation based on having to go through the process myself. And as Mike can testify, I'm probably really tech savvy, right, Mike?
Well, no comment there, but I will say that my parents are in another county and we were trying to sign them up. They share an email address. And the site only let you sign up with individual email addresses. So I had to go and create my mom her own individual email address just for the purposes of signing up for the vaccine. And some of that stuff, if you think about it, it doesn't. If you would have just imagined your typical senior citizen in that area and imagine them filling the stuff out, you would have said, yeah, we need a better way.
Yeah, it's an unnecessary barrier that absolutely plays to the technology barriers, to age barriers, to access barriers. I will say that I expect that all the providers recognize this. As a local health department, we are acutely aware of this, and that is, I can say that this is probably not the manner in which local health departments would have chosen to provide it. We have to fit within the guidelines that we're given or risk not getting the vaccine at all. And we're not going to do that to our community, right? I really hope that we will get to the point where we are able to open up a little more, knowing full well that we'll need to assist people with a paper version of registration or a telephone register on the computer, because that's still going to be the easiest way. So I think as we slowly roll things out, that's where, when we have permission to put our mobile vaccination teams into action, and we're looking at not only the rural, but like our farm workers who may work, they operate around the clock in some of these bigger farms. Our senior citizen high rises, right, and other apartment dwellings, I think we will have a little bit more flexibility to help register people. So for example, I'm aware the city fire department stays in some regular communication with our senior centers. And we asked, start collecting the names and phone numbers of people within your residence who will have interest in receiving the vaccine, so that when we anticipate getting it, we can set up the clinic and register people. We can call them and just, whether we're doing it by floor, whether we're doing it, alphabetically, however we choose to do it. It'll be very labor intensive, but it'll at least, get the job done.
Is there any opportunities for volunteering? I think about our organization and other organizations like us who might be in a position to offer you assistance. You mentioned high rise, and I just think about, taking a day and going over there and pre-registering people, even if they're not going to get an appointment at that moment, but to take it, pick up a senior citizen center, go over there and pre-register everybody that lives there.
I think it would be fantastic to pick it. I guess I would look for your organization to pick a designated person who then could look at the membership and say, these people would be willing to perform that action. You can let me know. I was going to say probably the best email to send it to, rather than my personal work one, is CC Health. It stands for Cayuga County Health at cayugacounty.us, because there's about half a dozen of us who look at that email site, and then we will work you in with our partners, because I absolutely see a role for people volunteering to do that.
Well, that's awesome news. And so I'm going to say this to everybody who's listening, that we record this and then we repost it so that members who weren't able to attend can watch it. So I want everybody to know, I want you to refer to me if you have an interest in participating in something like this. I'm more than happy to organize it. And so I use my email, mac13160@gmail.com. And just reach out to me and let me know that you have an interest. I'll wait till next Tuesday to do anything about it, to see who I hear from. And we'll put some kind of a group together, and I'll be in touch with Kathleen, and we'll go from there.
Thank you.
Thanks for the opportunity. I know there's more that can be done. I feel like we're a wasted resource when it comes to this, and even though we've done as many things as we have done, but I think the vaccination and getting people registered for vaccine and so on and so forth is probably the paramount thing that has to be done.
I would agree. And thank you for offering to do this. I think people want to be able to help. And at times we're just drowning in the immediate response, right? And as much as we can plan all we want, these plans we constantly have to alter them as our regulations change. So this is, sure, I think will be a great opportunity for all of us.
Mac, can I ask a question?
Sure. No.
I'm a little concerned about Mike Trapani. He has yet to blink since the meeting has started.
I think he left. I think that's an avatar that he puts up on all of his Zoom meetings, and then he goes.
I'm here.
Told you.
But
I figured you were taking a hot bath or something.
Oh yeah, something like that. We're helping with the grandkids today, so just listening in, and so that you're not looking at my ceiling the whole time. Here I am. All right.
Thanks, Mike. Put the picture back.
Kathleen, I see. To what extent is a lack of having vaccinators limiting the rollout rate of this thing?
I will say it's not limiting anything in Cayuga County right now, which is good. I don't know. I can't speak for other counties. We were concerned initially because we had a limited number of nursing staff, right? And that's a particular skill set. But the good thing is, and we'd seen this happen during the H1N1 pandemic and other situations, we know there are people who know how to give shots, right? Dentists give Novocaine all the time, right? EMTs might give an epi shot or whatever. people who give insulin shots, things like that. So we knew that there was a broader base who are capable of it and skilled in needle safety and all of that. The state pretty relatively quickly got not only the scope of professions that could do this. It was probably a week later than we wanted to see the training come out, but it came out pretty quickly. And that's what our EMTs through the city fire department all completed that. There's a medical oversight part of that. They have to demonstrate their skills. But that automatically like multiplied by more than 100% our number of vaccinators. We also had the opportunity, fortunately, also for good and for bad, that some schools were hybrid and others, school nurses stepped forward. So they've got their RN degree. We were able to hire a number of part-time nurses for this purpose that we're helping not only at our testing clinics and with case investigation and contact tracing, but also help with our vaccination as well.
What about the rural fire department EMTs?
Any of the EMTs through the county emergency management system and emergency management office absolutely can take the training and then have their skills demonstrated to the emergency management medical oversight doctor. I think that's Dr. Danello. I'm not positive on that. And they then can join the vaccinations process.
Kathleen, to what extent is the rollout limited by lack of proper refrigeration equipment? Is that still a problem?
It is if we were to have the Pfizer vaccine because of that super ultra cold level. We don't have that within the health department. Some of the bigger universities do, and some of the bigger hospitals do. But we've been getting Moderna right off, and it's 10 doses per vial, and they're small vials. And we cleared out our vaccine refrigerator of the other immunizations, and we gave that to other healthcare providers to make use of. And we made our refrigerator available. So if we got thousands and thousands of doses of Moderna or whatever, we can store it safely. And it's hooked up to a generator also as a redundancy.
So how many vaccines could you give in a week if vaccines weren't an issue?
It depends, how much we exhaust our people, right? So we did 2,400 in 6 days. That's pretty good.
Yeah.
That was operating great. But we also, that was the time we did that, we were also just gearing up our vaccines. So we could, if we pushed ourselves every single day, we could easily do 1,000 a day. But again, number of vaccinators, the space,
Right.
the place, how many hours you're going to work. We set a schedule. We know our vaccinators could work a little faster, but often there's a backlog at the screening. So we can only pace a certain pace, right? So we do, our ideal pace is one person per vaccinator every 5 minutes to go through. So we have 8 vaccinators. We're sending 8 people through every 5 minutes, get 10 vaccinators, etc.
Right. And then and I only know what I read on the news, so forgive me if my information is low, but it sounds like the Johnson & Johnson's vaccine is going to be less effective. Are you providing any guidance in regards to whether certain people should wait for different vaccines, or should people just get whatever vaccine they can get, or how are you looking at that?
I would certainly defer to our medical director for that information. We don't have a choice in what we receive, right? We consider it fortunate that we're getting what we get, right? So if you're getting your shot from us, you're getting Moderna right now, and that's just the way it is. You don't have an option. Upstate University, through their hospital, had Pfizer, and Onondaga County at some of their clinics had Pfizer available because of that close proximity to upstate and the freezers, and like SU and their research areas had some of these deep freezers. All we know is that whatever you get the first, you get the same one for the second if it's a 2-dose process. I will say in listening to some of, the Johnson & Johnson, it's going to go through the same rigorous process, right? And FDA is not going to release it unless it's going to be beneficial. What a huge bonus that'll be if we get to a vaccine, which is a one shot. Wouldn't that be great? That much more efficient for everybody.
Good, Ed.
Question for you, Kathleen. High school athletics. How confident are you that this is going to get pulled off and there's going to be actually real seasons this winter for this 6-week period?
I will say, and this is, I'm not saying it just here, I think it was said publicly, we were surprised that high-risk sports were being allowed, by New York State with the permission of local health departments. So we had a lot of consultation with, primarily, we know this applies not just to schools, but our conversations was a lot with our school superintendents and athletic directors, with our board of health, with our medical directors, to get a lot of input. I don't mind saying I'm personally not a fan of doing high risk sports right now. I don't think it was a good idea, but we put a lot of safety parameters around this, and there's a lot of responsibility for the administrators of these sports. So you give it a try, I guess. You know what? As I was saying to different superintendents, particularly for the youth sports, I hope that there are responsible adults within the lives of these youth who are taking part, who are helping the young people weigh the risk benefits in their particular situation before they just automatically sign up. It was an education for me to understand that the thought was we're going to have abbreviated all 3 seasons. In my mind, if we were going to go there initially, it was just going to be spring season and see what our positivity rates were in outdoor sports with less interaction. But we'll give it a go. And the schools are taking this very seriously, and the non-school athletics know that they have to fall under the same guidance. So we'll know in the next couple of weeks how well it goes.
This is Mike Davis. I haven't been following the numbers in the different age groups, but for young people, what is the hate to say it, but mortality rate or serious consequences or hospitalization rate of the high school age people? I understood initially the concern wasn't so much with young people because there was very, very, very few cases of anyone young actually dying from it. It was the case that the young people would bring it to their grandparents. And now with the vaccine rolling out, it seems like those two are balancing out. What are the numbers look like from where you are?
So I think you bring up a good point. I don't have specific numbers with our youth. I think there probably is a way at some point it could be queried through the state, but unfortunately with the system we need to use, we don't get fantastic demographic reports. But to your point, you're correct. We haven't seen mortality, particularly locally with our younger people. But we also have to keep in mind, it's not about death. It is about death, but it's about the serious health consequences too. And we, again, haven't seen that as significantly with our younger people, although, there is that, these long-term virus effects that we're hearing popping up once in a while with some syndromes associated with the virus. We certainly have had some young people in our county who've had that impact them. We've seen people in the, I'll call it middle-age group, right, who've had some extraordinarily serious health impact. They didn't die, but just because they got out of their 10 days of isolation, they weren't healthy, and long-term hospitalizations, and we don't know the long-term effects of this virus. I think there really is a benefit to getting diagnosed so that you know whether you actually have the virus within you, even hopefully you're not significantly ill, right? But you're right, we by far are seeing the greatest mortality in our oldest demographic, right? By far. Those are the people who have the greatest mortality rate right now.
Kathleen, along with this opening of sports, is that going to include things like swim teams and things like that? I mean, is that all going to be part of this?
So whatever sport, so yes, Yes, so there's a whole list of sports on some of the websites that the state oversees. So this high risk was really the one that was the catchphrase here, because the medium risks and the low risk were already being performed, like bowling was being done, and that was considered a lower risk.
Swimming started back in December and has been going on. I don't think there's been too many problems with that.
Kathleen, you mentioned that you started widening the scope of vaccinations for the first phase of recipients, but then narrowed it back down. What determines when to advance to the next phase? Is it total vaccination for that phase, or a majority of vaccinations for that phase, and then you enter into the next phase? I'm just curious how it works.
So we had to narrow it back down because the state told us we had to. We wouldn't have done that otherwise, probably. But yes, from what I'm hearing, based on this is part of the challenge in the information sharing that we as localities, but even, state health department is faced with. For example, we have a good sense of the numbers of first responders. So when we look at EMS, you're registered. Police departments can tell us their census. Fire departments can tell us what their census is. We, as a local health department, we are not keeping tabs on, did your fire department vaccinate 80% of their personnel? We're making sure it's available. We hope that the various fire departments are keeping track of that. There is you have to, when you fill out to register you as part of your online registration, there is a how do you qualify tag, button that you would push. So that's gathering some data. This would be part of the information sharing concern that as a local health department, we share along with you.
Anyone else have anything for Kathleen?
It's Eileen DeLoya. So from what I'm hearing, it sounds like the state really is not pushing down the information to the local counties on a granular level so that you can have a better sense of where this is going, big picture. Is there anything that we can do as Rotary and as citizens to push our local legislators to help you get that information so you can be more educated in your decision-making process?
Thank you for asking that. And I hate to, I'm not a state hater, right? That's not my nature. And I definitely didn't feel that way. As things were rolling out, I thought we were getting some decent information. It seems to be really where I, in my role as health director, have seen the greatest stutters during the vaccine rollout. There was a great article in the New York Times yesterday that spoke very much to the frustration every local health department and local health directors and hospitals were experiencing, because we have for decades, and I've worked for the local health department for decades. I helped write this plan 20 years ago for vaccine rollout and pandemics and emergency planning and all of these things. They were in place for a reason and they weren't being utilized, which was surprising to all of us. And it wasn't conveyed well why that's happening. It wasn't conveyed well why were hospitals being asked to be points of distribution of this vaccine. It certainly makes sense hospitals should vaccinate their healthcare workers. Absolutely, it does. They do not want members of the public walking into a hospital that is for sick people to get their shot. People should not go to a hospital to get their shot. They should go almost anywhere else to get their shot, but not to the hospital, right? Don't let the hospital focus on sick people and helping make them better. And they will agree with me, right? I would say, if you have the opportunity to read that article, it articulates things pretty well from a point of view that I support. I would also say, speak to your state representatives. I feel like I have really good support locally. I overall tremendously supportive legislature. We don't always have to agree, but they're listening, they're taking action when we have made this request. Right? It's government. Sometimes I feel like, and I know Trish Kerr is on, so I'm being cognizant of that. Sometimes it takes a little longer than you want it to, but we have staff to do the work now. We have people to do the case investigation. We certainly are being supported. Local people are supporting each other, right? We all live in this community. We're supporting each other. So that's where I think it would be more helpful, probably speaking with state representatives to inquire through the governor's office why certain things have rolled out in the manner that they have. And we don't want to be finding things out during a press conference. Give us a little heads up so that we can plan, so that we can roll with the punches. That will help everybody in the community a little bit better.
I'm gonna jump in here because we're kind of time sensitive. We don't want to keep. We got people who are going to start dropping out. But Kathleen, I got to tell you that it's been an absolute pleasure having you and listening to your what you have to offer, and both your what are your concerns as well and issues as well as what's working well. So I will definitely be in touch with you once I sometime after next Tuesday once I hear back from other members of the club, and we're going to push forward to try to help you in some way with, if nothing else, at least registrations.
Great. Thank you.
So thanks everyone for joining. Watch for the minutes, which will give you a link back to this video, and I'm going to use a different ending here. Kathleen, I'm going to say to you that if there's any time that you need to voice and you need some place to air that, you contact me, okay? And we'll get that. We'll get you in to talk to Rotary and spread that word in a way that I think will be beneficial. We're not typically the people who point fingers. We're problem solvers, and so anything we can do, you keep us in mind. Okay.
Thank you. Thank you for the opportunity.
All right. No, not at all. Thank you. Until we meet again. Happy trails, and we'll see everyone next Tuesday, same time, same station.
I just want to say thank you guys too. That's awesome that you are so involved in the community and offering to help and coming up with solutions here. It's great. And so I just want to say thank you for that. And Kathleen's awesome. So I learned a lot. Every time she speaks, I learn something new. So anyway, this was a great program, and I definitely am looking forward to joining up with you guys.
And who is speaking now?
Send me an email so I can get your contact information. This is Paul Barris.
Okay. And this is Tricia Kerr. Okay.
All right. I just need your contact information so we can follow up with one another.
That sounds great. Thanks, Paul.
And this is Eileen Deloya. I want to apologize for getting the minutes. A lot of upheaval in my life. My brother moved in with me, so I've been teaching him computers and such. So I was a little bit delayed getting the minutes out. I sent them to Donna today for a first review from last week. I took the minutes today. I will get them up to her before close of business today. So in the next couple of days, you'll be getting the minutes from last week's meeting and this week's meeting. And in last week's meeting, I put in some hot links for where you can go get vaccinated, sign up for vaccinations. So you'll be getting them in the next day or so. All right.
Great. All right. Thanks again, everyone.
All right.
See you next week.
See you next week. Bye.
See you later, everyone.
See y'all later.